Hello everybody, my name is Erlan Nosipov. I teach at Kazakh Medical University of Continuing Education. Today I will tell you about a violation of water electrolyte balance. Why water electrolytic and not just water? Because electrolytes are dissolved in water and cannot participate in metabolism without water. In this video I will focus on only water imbalance. Water determines volume, electrolytes determines osmotic pressure. As you know, the water content in the body is 60 in an adult and 80 in a newborn. Water is contained in tissues in the following proportions: intracellular 70%, extracellular 30%. What is water balance? Water balance is the balance between intake and excretion of water from the body. The amount of water balance is about 2.5 liters per day. What forms of water imbalance are there? Negative, little water enter and a lot of excreted from the body, hypohydration. Positive, a lot of water enters and little excreted from the body, hyperhydration. Let's start with negative water balance, hypohydration, when little water enters and lot of excreted from the body. Causes of hypohydration. Hypohydration is divided into isoosmolar, hyperosmolar, and hypoosmolar hypohydration. With isoosmolar hypohydration, equal loss water and electrolytes. Causes of isoosmolar hypohydration: initial stage of acute blood loss, extensive burns, bacterial dysentery, cholera, stenosis of pylorus, brain disease with a lack of thirst, fears of hydration when the person sick with rabies, and the coma. With hyperosmolar hypohydration, more water loss. Causes of hyperosmolar hypohydration: reduced water intake, drinking seawater in hypohydration, hyperthermia, hyperparetic fever, diabetic insipidus, prolonged artificial lung ventilation, hypersalivation in children. Hyperosmolar hypohydration, more electrolyte loss. Causes of hyperosmolar hypohydration: excessive sweating, diarrhea, repeated vomiting, polyuria, Addison diseases. As I said above, hypohydration is divided into isoosmolar, hyperosmolar, and hypoosmolar. With hyperosmolar hypohydration in the intracellular space, the water content decreases, but the level of electrolytes increases. Accordingly, the oncotic pressure increases. With hypoosmolar hypohydration, the water content in the intracellular space decreases, and level of electrolytes decreases, and oncotic pressure decreases. With isoosmolar hypohydration, equal loss of water and electrolytes. At the cellular level, during hyperosmolar hypohydration, water leaves their cells. With hypoosmolar hypohydration, water enters the cells. Further, the chain of pathogenesis is as follows: decreased circulation blood volume, lowering blood pressure, increased blood viscosity, microcirculation disorders, renal ischemia, decreased renal filtration, oliguria. Then, when water leaves the cells, dehydration and shrinkage of cells occurs. Dehydration leads to hypoxia, metabolic acidosis, and clinically thirsty. Shrinkage of cells leads to the breakdown of tissue proteins and clinically to fever. When water enters the cell's edema occurs, which also leads to hypoxia, metabolic acidosis, and clinically increased intracranial pressure. All this leads to autointoxication. Autointoxication and clinically manifestate as central nervous system dysfunction, severe headache, hallucinations, and coma. Okay, we talk about negative water balance. Now let's talk about positive water balance, hyperhydration. Positive water balance, this is when a lot of water is supplied and little is excreted from the body. Causes of hypohydration. Hypohydration is also divided into isoosmolar, hyperosmolar, and hypoosmolar. Causes of isoosmolar hypohydration: infusion of great amount of isotonic solution, congestive heart failure, hypoproteinemia, chronic lymphostasis. Causes of hyperosmolar hypohydration: infusion of the hyperosmolar solution, first intake of seawater, acute renal failure, hyperaldosteronism. Causes of hypoosmolar hypohydration: increased production of antidiuretic hormone, decreased kidney function, water intoxication. With hypoosmolar hypohydration in the intracellular space, the water content increased and the level of electrolytes also increased. With hypoosmolar hyperhydration in the intracellular space, the water content increases, but the electrolytes level decreases. As the cellular space during hyperosmolar hyperhydration, water leaves its cells. On the other hand, during hypoosmolar hyperhydration, water enters the cells. With isoosmolar hypohydration, dropsy occurs. Dropsy is an accumulation of transudate in any body cavity. For example, is the abdominal called ascites. With hypoosmolar hypohydration, edema occurs. Edema is the accumulation of fluid in the tissue of the body in the intracellular and cellular spaces. With hypoosmolar hypohydration, water intoxication occurs. Consider the pathogenesis of water intoxication. Excess water intake against a background of refused kidney function, increased water in the extracellular sector, the relative decrease in red blood cells, proteins, and sodium in the blood, decrease in osmotic pressure in the extracellular space, increased water intake into cells, then intracellular edema occurs. This leads on one hand to increased intracranial pressure, the other hand to cytolysis, hemolysis of erythrocytes, what is manifested by hemoglobinemia, hemoglobinuria, kidney failure, hyperosmolemia, and autointoxication. All this leads to central nervous system dysfunction, headache, nausea, vomiting, aversion to water, seizures, coma. So, I briefly talk about the water balance of the body and forms of water imbalance. Thanks for your attention. See you.